Hi, I'm Dr. Julie Steinauer, and today I thought I would kind of do some debunking on autism. I've had a lot of patients coming into my clinic more recently with autism, and it's always being asked, can we do anything? What can we do to help these patients? I've talked about autism before, and I maybe have skirted around the issue and not given as much detail, and today I just decided to hit it head on. So autistic patients always have some sort of visual problems. It's not a maybe, it's not a let's figure it out, wait and see, let me test you first. It's always. There's a lot of things going on with these patients, and we have to remember that autism is generally an umbrella term for a lot of those things going on. There's behavior things, there's potentially problems with socialization, learning difficulties. So there's a ton of things happening for these patients, and vision is always a component of that. So what are the things that I typically see with my autistic patients in the clinic? I would say about 99.99999% of the time I typically see that they have some sort of an eye turn or strabismus. It might even be the case that they have amblyopia, although I don't see that nearly as much as strabismus. Other things going on for them are definitely, obviously, problems using their two eyes together as a team, tracking, and focusing skills are always difficult. But then there are other things like vision perception, and they have difficulty with discrimination maybe, or visual memory. Although a lot of these kids will have super high numbers and percentages and perform very well in some of the discriminatory and maybe analytical visual skills. So it's kind of surprising. But that's maybe their area that they excel in, and the alignment of the eyes and the two eyes being used together might be the area that they struggle in. So autism is a big spectrum, and there can be a lot of ways that kids react with that, kind of like with that diagnosis, if I can say. So is there always something to do with vision and autism? Yes. And is there something that we can do to help these patients and students? Absolutely. So for more information, go to visionforlifeworks.com.